not every woman is born beautiful because the beauty, it's sort of a societal normal standards and they differ depending on culture, depending on the time we live. So what we're considered beautiful, like we'll say even in the 80s, is no longer beautiful in 2026. And then obviously what's considered beautiful in Asia is not beautiful in Europe or United States. So beauty, it's a very kind of a feeding subject.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Natalya Borakowski, a licensed naturopathic physician specializing in women's health and cosmetic dermatology, with nearly 2 decades of clinical experience in aesthetic medicine. She is an international trainer for a leading absorbable thread company and a sought-after speaker at prestigious global conferences, including IMCAS Paris. Dr. Borakowski is the founder of Desert Bloom Skincare and the creator of Unveil You, where she integrates skin biology, hormones, and the psychology of self-image to redefine how women approach beauty and aging. Known for her candid, science-driven perspective, she challenges fear-based aesthetic culture while empowering women and clinicians with clarity, ethics, and agency. So, Dr. Borakowski, welcome and glad to have you here.
Happy to be here, Daniel. Thank you.
Yeah, so let's start at the very top. How did you first get interested in the medical field?
Well, actually, I came to medical field from the world of cosmetics. So I've been in cosmetics since my early 20s.
Mm-hmm.
And the way I'm arrived in cosmetics, it's really by serendipity. So it's kind of an interesting story. One of my first jobs when my parents and I immigrated here in the United States, I was working as a teller in the bank. And our bank, Arizona Wild West, got robbed at the gunpoint, believe it or not. So, and I was by that time living by myself. So it was a really terrifying time. I couldn't sleep at night. I was super stressed. And as any normal, healthy woman, when we're stressed, we go through shopping therapy. So that's where I found myself. I was at the mall and I saw this huge billboard. Macy's was just opening in one of our major malls here, and they were hiring full positions. So I was a little lost in life. I didn't know what career I want to pursue and then what I want to do. So I walked in and I said, "Can I get a job?" And manager looked at me and said, "Oh, you're so cute. We're going to put you in cosmetics." And I said, "I don't even know how to put makeup on myself. I've never seen mascara." So she said, "Don't worry, we'll teach you." And that was it. That was my passion was born. And since then, I always learn. I really loved seeing that light in a woman's eyes when I give her a mirror and she just in love with her reflection. So little by little, I went through medical school and it's still with the same passion of just helping women to feel beautiful.
Excellent. So what made you decide to start your own business? I mean, why not just end up working for another practice or work at the hospital?
You know, my dad was entrepreneur because I grew up in the Soviet Union, and once the Soviet Union collapsed, I kind of seen him trying to different ventures, and I always thought it was really cool to be your own boss and do your own thing. So I worked at the mall, like I said, and was just done with selling and working for somebody else. I decided I'm going to open my little skincare studio, and that was that.
Okay, got it. Now, your background is in absorbable thread procedures. Can you talk a little bit about what is that? What is absorbable threads?
So absorbable threads are surgical sutures. They're created from different materials. Most commonly known in the United States are PDO threads. And unfortunately, they have kind of a bad reputation in this country, but throughout the world, they have really great reputation. They use during the surgeries as well as non-surgical procedures too. So essentially, we can mimic the same strategy surgeons use during a facelift or brow lift or a rhinoplasty and do it non-surgically. Think about like a kind of a gentle liposcopic surgery, if you will. And those sutures gently absorbed by your body anywhere from 9 months to 2 years, and you get semi-permanent results.
Okay. And so with that, and then some, you kind of parlay that into what you do now. So I know you have some courses, but can you kind of talk a little bit more about what is involved in your courses?
In my courses, that's kind of a big jump, Janelle. We were talking about procedures and we're
Yeah.
jumping into psychology. So
Yeah.
let me kind of backtrack a little bit.
Okay.
A few years ago, I had my little midlife crisis moment, if you will. So
Mm,
essentially, I found majority of women, new customers sitting in my chair, when I give them a mirror, they start piecing themselves apart. And
mm,
they're extremely self-critical, very just toxic towards their own image. So I was always wondered, how can I help this woman fall in love with her reflection? Because ultimately, what we offer in clinic, we just offer tools. But the women give a different meaning to those tools. And sometimes the meanings are not necessarily helpful. And often what I see in clinic too, we can give absolutely flawless procedure. We can give a fantastic result and the woman's still not happy.
mm,
So why that's happening, that's really what prompted me to start digging deeper, learning about psychology, the hormonal shifts. Because really, let's face it, there's so much happening in female bodies between age of 45 to 50 when they go through those hormonal transitions. And during this time, a woman becomes acutely aware that she's also aging. And for most women, it's time when she first time walks into aesthetic clinic and tries to do those procedures. So the platform was created for those women who curious, they want to do something or they tried something, but they still haven't found an answer. They're still not happy. They don't like their reflection. They feel lost. So
mm.
it's just helping them to understand their own biology, helping
Okay.
to understand what aesthetic medicine can and cannot offer, and ultimately cultivate really healthy, happy relationship with what they see in the mirror.
Okay. So between the treatments that you provide in your practice and then the course that you also provide, I guess is it the course is more for the psychological part of it, and then the treatments is the actual application of that.
Right.
Mhm.
So ultimately, the course was created so my a kind of like opportunity to trying to reach out more women, the women that cannot sit down and talk one on one in clinic. Because what I unfortunately see in many medical spas, practitioners don't have time to go and sit down and talk half an hour with a patient. And I really often don't have that time either.
Mm,
I actually get very excited when I have a cancellation in clinic and I have more time to sit down and talk to that woman that sits next to me because
mm,
I can dive deeper and talk to her about what's going on with her hormones, how is she managing stress, is
mm,
she eating nutritious food, how she's supporting her body from inside out. That's really what that platform was trying to do, is to give me the opportunity to reach those women, to buy that time that I don't really have in clinic every day.
mhm,
They don't replace procedures, obviously, but ultimately they give a woman education and information to being able to become her own advocate and make educational choices of how she wants to age. It doesn't matter if she chooses to age with Botox or without it, because there's truly no correct answer. I think every woman needs to choose that from the point of self-love and agency instead of that fear and urgency that we typically sell when we talk about cosmetic industry.
Okay. And now, when we're talking about kind of a little bit more the psychological part of this, how does that play a role in how women view themselves and how you kind of help them through that? Like, as far as society kind of viewing women in a certain way, and then the whole thing about women aren't vain and all that. Like, how do you help to reconcile that with women that come to you?
That's a very loaded question, Danielle. First, I hate the word vain.
Mhm.
I have a big beef with it. And I usually, especially when men say, oh, we want women to be natural. Women are so vain. They want to be
Mhm.
doing all those procedures. They're getting fake. Well, the truth is, majority of men will never guess what procedures women have done because well done procedures are undetectable. She just looks beautiful. She looks polished. She looks like she takes care of herself. And so assuming that the woman who ages naturally is the beautiful woman is always, sort of my opinion, false narrative. We're jumping from two extremes of either overdoing aesthetics or not doing them at all.
Mhm.
It's ultimately using the tools in aesthetic medicine to help you to enhance who you already are. And as for relationship with your mirror, that's very loaded question.
Mhm.
Because during that time of hormonal rebalancing, if you will, a lot happening with our central nervous system. So the way we even see ourselves becomes a little bit skewed. Essentially, what you see in the mirror, it's truly not your reflection.
Mhm.
First, our brain actually saves images of you, sometimes several years prior, a few days prior. So often when you look in familiar mirrors, you kind of like the way you look because your brain just memorized that old picture of you. Brain just serves energy, so it doesn't really have to see every nook and cranny that's happening in your face.
Mhm.
And then at some point, somebody takes unsightly picture of you, or you look at the Zoom camera with a bad light, and all of a sudden you feel like you aged 10 years. So that's typically the moment when a lot of women will dial up aesthetic injector and say, oh my God, I look horrible. I just saw this. So that's also a very skewed image. And we have to see that reality from truth and help that woman to see what reality really is. Because aesthetic medicine should be more so supportive, not necessarily corrective. So
Mhm.
again, when women understand what the tools offer to her, she can choose how to age with the tools or without them.
Mhm. Okay. And there's this concept that women kind of never get a break. Do you see that more as from a physical perspective or more from a um, expectations that society put on them, or even from both, or even from other areas as well?
You know, expectations from women to look beautiful and youthful existed for generations, for
Mhm.
thousands of years.
Mhm.
Women's always been praised for being pretty. You know, beautiful women will get more. They get wealthier marriages. They have more opportunities in life. So no wonder we worship youth and we worship beauty. So
Mhm.
when we say the women are vain because they want to look youthful, it's kind of like a confusing narrative because we want her to be youthful. So that's just, you cannot really blame women to want it to be what they're really praised by our society. What
Mhm.
makes our current society is different
Mhm.
because we all aging in front of camera. And that's a new thing that's just started to happen in the 21st century because everybody have an iPhone.
Mhm.
Now we have all those Zoom meetings, we constantly on camera. So we evaluate ourselves from all possible angles. And that's where all that negative self-talk becomes even more toxic because we are constantly seeing our image. We're not used to that.
Okay. Now, I want to shift over to your actual practice. Like, this is the part where you're actually helping do the actual execution of this once they have the psychological part kind of set.
Yes.
How do you determine which treatments to give to a specific person? Like, you kind of figure out what is their goal first, and then from there put it together? Or do they come and say, like, hey, I want this, or I want Botox, I want filler, I want facial bouncing, I want whatever it is? Like, how do
Yes.
you make the determination?
Yes. Well, I kind of use both. If I have a patient coming in asking for a specific procedure, my first question is why? What's the intention of that procedure? You're
Mhm.
asking for Botox? Okay, great. I mean, it could be a person who's been doing it for, I don't know, let's say 20 plus years. They know exactly how many units, where they're injecting it. They just moved here from different states. So I'm just replacing what they've been doing for many, many years before. I'm not going to give this woman some deep psychological talk and explain what Botox does. She already has her routine. She already knows what she does with that tool. So here, I'm just an executioner. I'm delivering the treatment she's asking me for. When I have a woman who is a little bit lost and she just comes in and does that, what I call it, piecing yourself apart in the mirror, then I start to have that conversation. And we talk about it jointly. So maybe it's not really a dark circles that you're concerned with. Maybe because you're not getting enough sleep. Maybe you should talk about hydration. We should talk about making your skin healthier overall. So before I jumped into specific procedure, I will again trying to figure out what is the really reason she's concerned with whatever feature that she's not happy with.
Okay. Okay, so when it comes down to the actual treatments themselves, so I guess the treatment side and also the psychological side, I'm sure that you hear a lot of misconceptions, a lot of myths that your clients and your patients have.
Yeah.
What would you say some of those most common myths that you hear from them?
The most common one, and people are going to hate me for saying that, neurotoxins or specifically Botox, because everybody knows Botox by name,
Mhm.
erases wrinkles. It doesn't. It paralyzes the muscle. So
Mhm.
that's the biggest myth. Everybody's coming in. I have a wrinkle here, inject Botox there. I
Mhm.
mean, most educated people will know that if you have a smile lines around your mouth, I cannot put wrinkle there. But if we, as practitioners, educate our patients properly and just explain this is a neurotoxin, this is a muscle relaxer, And then the skin is the one that really erases wrinkles. Then the whole story about the skincare becomes completely different. So perhaps she doesn't even need to inject Botox there. Maybe she just needs to upgrade her skincare. Maybe she needs a good facial. Maybe she's 20 something and she starts to see wrinkles. It's not because she's moving her muscles too much. Her skin is still too young. Maybe she just simply dehydrated. Maybe she just came here from 12-hour flight and that's why she looks so exhausted and asking for Botox, but it's really not the tool at this moment. So
Mm.
it's just truly understanding what is this medication really does for your body. So yeah, the Botox is the biggest
Okay.
myth for sure.
Okay. So, and again, I'm sure there's tons of other myths that you hear. How do you approach the educational side of this? Like when someone comes in that they have these misconceptions or they think they need something when they really don't. How do you approach that educational component of it to make sure they kind of really know what they're getting into and maybe even changing their mindset on what they think is true, but is really not?
No, it's not always possible to change the mindset, Daniel. It's just being honest, transparent, and then just explain them. My job is to give you information. What you're going to do with this information, it's up to you. But I will refuse to do something on your face that is could potentially be harmful or something that you just simply don't need. I turn away people all the time, which is I know it's kind of strange in this industry. And my husband, who's running the front house and does financing, he sometimes gets angry at me. He just says, like, can you stop turning people away? You have so many consultations. You just, really need to inject something. We
Mhm.
do have a deadline. Yes, we are obviously profitable business, but I just have a very high value in my patient safety, I guess. I really have a high standards for what I expect from myself. So I would never do something that the woman in my chair doesn't need.
Mhm. Mhm. And I think, you know what, when you turn people away, I actually think that builds more trust. Because if you're willing to say that, hey, you're not a fit or I can't fulfill your crazy expectations, it says something about you as a ethical provider. And that you're not willing just to be an order taker, is that, hey, I don't believe that this is the right thing for you. I'm not going to do it. So I actually think it builds more trust than anything else.
If anything, it builds trust within me
Mm-hmm.
of myself. I know what I'm capable of. I know limitations of treatments I can do. And I always have my motto I live by, it's under promise and over deliver. So
Mm-hmm.
I was very conservative for what I can promise to my patients. And also being a naturopathic physician, I always talk to them about foundations.
Mm-hmm.
So if you don't take care of your body, if you don't really sleep, eat, move, and manage your stress, then whatever we're doing with injectables is not going to work that well.
Okay. Now, that kind of leads me into my next question. Let's say that someone is looking at getting some type of aesthetic procedure or aesthetic treatment done, but they don't know who to go to. They don't know which provider to choose. What advice would you give to this person as they're doing their search so they can find that person who is ethical, who does have the experience and knowledge, and is going to get them a good outcome in the end?
Well, it's you can always go for consultations. I mean, majority of clinic will offer you free consultations and sitting down and asking provider questions. Like specifically, you go in and say, let's say dark circles again, right? Since we talked about dark circles before. I don't like my dark circles. And if you feel like provider is selling you on procedure, to me, it's a big red flag.
Mm,
Because if provider doesn't ask questions, how do you sleep? Have you been traveling a lot? Are you using any skincare? Are you drinking enough water? That's already provider doesn't really care about your health and they just want you to sell procedure. And if they don't give you alternative procedures, like something they don't do, for example, like again, speaking of dark circles,
mm,
perhaps the person there is a candidate for blepharoplasty. So if I'm looking at this person and saying like, okay, I can give you procedure XYZ, but I can also tell you there's a surgeon down the road that does wonderful blepharoplasty, and that will give you the best correction if the surgical option is for you. Because some patients completely would never even consider going under the scalpel. But I'm always giving people all possible options and giving them choice to evaluate what will work best for them.
Okay. And so it sounds like they need to just be careful, make sure that the provider is not just trying to oversell them.
Yeah.
What about when it comes to quality? Like, should they, if someone is giving them a really cheap deal in their backyard or in their garage,
Yeah,
what
that's
are some of
definitely
the
a red flag.
potential
Red
dangers of
flag.
that?
Yes. Well, the major danger is if you're doing it in the backyard in somebody's home, it's very likely to be unsanitary. So you're at risk for infection. And if you're doing more serious procedures, like we'll say thread procedure, if the thread becomes infective, it could become a major problem. It could cause permanent scarring, yeah, I don't even want to go there. It could be a really big problem.
Just don't do it.
Same thing with the fillers. A lot of people will go shop for something what they feel as simple as lip filler, we'll say, because a lot of women treat lip filler injections something like trying on a new lipstick, but it is a medical procedure. And unfortunately, again, not to scare our listeners, but it's a truth. The big black box warning for dermal fillers is blindness and tissue death. So that happens when not certified, well-trained practitioner will inject filler in a blood vessel. And the smallest artery in our face is a retinal artery behind your eye. So even the lip filler can leave you blind.
Oh, wow.
So when you really don't understand credentials of the person who is injecting you, if you don't know the product injected in you, you should always know. You should ask, like, where the syringe came from? What's the brand of the filler I'm injecting? Why are you choosing this brand? Because we have so many different fillers. The practitioner should be able to explain why this is the choice, why they prefer to work with this product but not the other product. So,
okay, great advice.
Transparency is the key.
Yeah.
That's my advice.
It's a good saying. Okay, so then, Dr. Borakowski, what role do you believe creativity plays in your approach to patient care?
Aesthetics, it's definitely art. There's certainly some creativity there, but aesthetics, it's such a powerful medicine. It has a lot to do with psychology. So I think before we get into the creativity, we need to make sure that our goals as a little artist with a syringe really aligns with the vision of our patient. So yes, we can sculpt a really beautiful face, but what if not the face that she wanted? Because the human faces, they're not just pieces of art. They create a lot of meaning for people. Just think about it. In our society, we evaluate person within like less than 5 seconds based on what they look like, the quality of the skin, their eyes, their ethnicity. We immediately create some kind of narrative about this person before they even say anything. So if we do an aesthetic procedure that make a person look like someone and they're not ready to step into this identity, we might give them a horrible disservice because now they're going to feel like they don't belong in the body they all of a sudden have.
Mm-hmm. Okay. So I guess having that artistic eye is also important in a provider as well.
Yes.
So
yes. More artistic eye is important, of course, because again, we don't want to lose the sight of overall harmony of the face and then just create like beautiful lips and everything else kind of like doesn't belong there too.
Mm-hmm. Okay. So everything has to balance.
Correct.
Got it. Okay. Now, Dr. Borakowski, I'm sure that you've had some memorable cases throughout your career or even maybe challenging cases. Is there maybe one story that you can share of just one of those cases and how you were ultimately able to get a good outcome in the end?
Memorable cases. Well, probably the scariest case I've ever been through. It's one of my thread patients who had Bell's palsy, which is really spontaneous disease. It can form it really at any time. And thankfully, with a really great resources I have, a lot of my friends and naturopathic physicians, we were able to get her back into normal and fully functioning face within less than 10 days. But it was scary 10 days of my life. And I'm really very empathetic person. So I was in the office at 8 o'clock in the morning every day. So I can see her put her on that little electric machine thing we do in it. I don't even remember the name of it. And all the medications we prescribed to her to stop that nerve damage. And just hold her hand through this because it's scary. Like when all of a sudden you cannot move one side of your face and you don't know if it's going to resolve. And frankly, I didn't know when it's going to resolve because it's such unpredictable, spontaneous disease. And thankfully, everything worked out well. And I thought maybe even doing like a medical case publication because of all the steps that we took to help her to recover so quickly. But then it was just too painful to visit all those 10 days that I
Yeah.
lived through. And I just decided I'm just going to leave it to rest. Maybe like in another 5 years or so when it's not going to be so difficult to talk about this.
Mm.
But that's probably the most memorable case I've lived through. But as without the complications, I had so many wonderful stories because I've been in practice for so long.
Mhm.
I had patients who would invite me to their weddings. I've seen them from the moments when they're little, pimple covered teenagers and to now having two children, which is it's just great. It's really
Yeah.
see that woman blossom and step into her feminine power, becoming confident and building family. It's rewarding. It's wonderful.
Yeah, and I think it's a testament to the quality that you deliver. If they're inviting you to their wedding, or they're bringing their children, or they're coming in when they were young, so there's just that longevity there.
Yeah.
So now, where do you think the future of aesthetics is going?
Aesthetics is certainly shifting. So we went from kind of like this post-COVID era when everybody were on camera and driven by fear of what in the world happened to me, inject as many things as possible. So as a result, a lot of people got overtreated, over-injected. So we've seen it in celebrities' faces. And now we have this whole swing of pendulum. Let dissolve all the filler. I want natural. I don't want any injections, which is also again driven by fear. That's not normal. I
Mm.
think now we're stepping into that era of rejuvenation, which is wonderful. But I really don't like using regenerative treatments without talking about the body itself. Because right now, every clinic happy to um, offer peptides, offer PRP treatments, we name it. There's so many different ways you can regenerate the skin. But if your body is not ready to create that collagen, again, if you don't take care of the foundations, which is sleep, proper nutrition, managing your stress, and moving your body, because your body needs to circulate that blood and lymph and flush out toxins. So if you don't doing this, you don't really get great effects from rejuvenation. I think some practitioners could do those regenerative treatments, but they missing this fundamental part of supporting the body. They gonna have disappointed clients, and then we gonna have this rejuvenation kind of fall out of flavor at some point, and
Mhm.
we're probably gonna have new tools rising in the market. There's always new tools.
Mhm.
I travel, I go through the world and speak at different conferences, like really from all the corners in the world, and there's always something new emerging because people want to look beautiful. Women don't want to age. So there's always going to be new tools. We just need to make sure that our narratives change and we really listen to our patients and we mainly asking why they want to do procedure and what they do to take care of the body before they take care of the exterior.
Okay. And with that future in mind, what is your vision for your business, your practice, Desert Bloom, and also I guess, the training side, the Unveil You?
Well, Unveil is still a baby, so we just launched it in November. So it's a
Mm.
very fresh platform. So we're still kind of growing. We're gaining more followers. I'm also writing a book, so hopefully the book will be published in the next couple months. So if any of the readers are curious, they can go to the unveilyou.life website and just put their name on a wait list or on our mail list, and then we'll just let you know as soon as the pre-sale is available. But ultimately for my practice, I love my practice and I'm getting more people working for me and doing the work that I do because I'm getting older. I'm not going to be doing it forever. But ultimately, I want to really expand our digital platform because I really feel like we can reach out to more women. Because I still, since I was a little girl, always believed and I love to see every woman to feel beautiful. So when she sees her reflection in the mirror, she smiles and she's happy for what she is. That's really what this platform was created for. And I hope we continue to grow.
Awesome. Well, I have one last question for you. But before I ask it, I do want to point people to your websites at desertbloomskincare.com. And as you mentioned earlier, unveilyou.life. Now, last question for you, Dr. Borakowski. What does beauty mean to you?
Beauty to me, I that's a great question because it's such a deep philosophical question. I was just writing about it in my book. Not every woman is born beautiful because the beauty, it's sort of a societal normal standards and they differ depending on culture, depending on the time we live. So what we're considered beautiful, like we'll say even in the 80s, is no longer beautiful in 2026. And then obviously what's considered beautiful in Asia is not beautiful in Europe or United States. So beauty, it's a very kind of a feeding subject. What I'm really thinking about beauty, it's attractiveness. It's a woman feeling attractive in her body and attractive on a photo, attractive in the presence of other women. And that could be cultivated. And that comes from self-care, taking care of your skin, taking care of your hair, taking care of your body, and ultimately establishing that self-trust. And then when you enter the room, your eyes glow and you happily smiling. You don't feel confused or uncomfortable because it doesn't matter how beautiful you are. If you don't trust yourself, you're not going to appear beautiful to others.
Very well said. Well, there you have it. Dr. Borakowski sharing her expertise. So where can people contact you and your practice?
They can go visit our website and they can, if they like to schedule an appointment, there is a booking online and there's a phone number online. They can also find us on social media. I'm just on Instagram because I'm only one person. I cannot do TikTok and anything else. I'll go crazy. The Instagram is unveilyou.life and Natalya Borakowski.
Nice. Okay. Well, Dr. Borakowski, this is great. Thank you for coming on. Thank you for sharing your knowledge and thank you for sharing your expertise.
Thank you, Daniel. That was great.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.